everyone, and welcome to day 1 of week 2 of the quarter. Hopefully you all made it through week 1 without too many issues, but I know that week 1 can be very overwhelming. So for this week, we have 3 chapters that we're focusing on again, chapter 34, chapter 35, and chapter 42. For this day 1 video, I'm going to strictly focus on chapter 34. We will discuss chapters 35 and 42 in the day 2 video. So let's go ahead and get started. So chapter 34 is the chapter that's really focusing on infection control. This is really a process for medical assistants and all medical personnel to help reduce the exposure to pathogens to prevent the spread of diseases. Pathogens are disease-causing microorganisms that are found almost everywhere. As a medical assistant, you need to be aware of just how easy it is to spread pathogens from one person or one patient to another. This is why, as a medical assistant and medical professionals, we perform what are called aseptic techniques. And what that means is it talks about asepsis. And asepsis is a state of being germ-free and infection-free. Now, there are 2 types of asepsis that we will deal with. There's medical and surgical. Medical asepsis refers to making items clean and stopping the spread of organisms once they leave the body. The most important medical aseptic technique you will learn is obviously washing your hands with soap and water. Surgical asepsis, on the other hand, refers to being sterile and stopping organisms before they enter the body, such as what we use prior to surgeries. So when we are talking about being germ-free and stopping the infections, we need to understand that those come from any sort of agent. So some of the infectious agents that we may come into contact with are bacteria, viruses, protozoa, and fungus. Now these are microorganisms that can grow one of 2 ways. They can either grow aerobically or anaerobically. Aerobic means that they need oxygen to live, and anaerobic means that they do not need oxygen to live. So now that you kind of understand how microorganisms kind of spread from one person to another, you need to understand a very important process, and that's called the chain of infection. The chain of infection are 5 links that show how microorganisms really do get spread from people to people. So in the chain of infection, the first one that we have to deal with is this one here, this reservoir host. And a reservoir host is really the beginning. This is where the host is infected with some sort of microorganism. Your host, as you can see, can be human, or it could be an animal of sorts. It does not necessarily always have to be human. The second is the portal of entry. Okay, so what this is when the microorganisms enter the body and they get into the host, and this can be through any sort of open sores, open cuts, open wounds. It could be through sexual contact or blood contact, any of those things. Once it is entered and it wants to start infecting people, it needs to have a mode of transmission. Now that is really how your microorganism travels from one person to another. That could be either direct or indirect contact. The portal of exit is that exact same as the portal of entry. How it got in is how it will get out. And then the last step is this susceptible host. And what that means is it's a new host that is infected with the microorganism. And it has to be able to live within that new host body. As a medical assistant, it is our job to stop the spread of infection and break that chain. And the most easiest way that we can do that is making sure we're using proper hand hygiene and wearing the correct personal protective equipment. I would like you guys to review procedures 34.2 and 34.3 in your book prior to class on day 1. So now that we have really understood how microorganisms are spread, we need to discuss some infection control precautions and standards. So these three that we have here, the universal precaution, standard precaution, and transmission-based precaution, were all created by the CDC at different times in different years. The universal precautions were created in 1995 by the CDC, and they were created to protect healthcare employees from patients from either HIV, hepatitis B, or other bloodborne pathogens. Excuse me. The theory behind this is that the precaution is to treat all blood and bodily fluids as though they are contaminated. Standard precautions were also created by the CDC in 2007. This precaution recommends using precautions such as personal protective equipment when working with patients regardless of their diagnosis. This guideline applies to all blood, all bodily fluid secretions, except for sweat, whether blood is visible or not. Again, with the same thought that they could be contaminated. And transmission-based precautions is the second tier that was created on top of the standard precautions in 2007. These guidelines focus more on the infectious patients and how those patients are suspected of being infectious. So they break the guidelines down based on how the bloodborne pathogen could be transmitted, whether that be airborne, droplet, or direct contact. The last thing I want to discuss for the video this week is surgical asepsis. As I stated a little bit earlier in the video, I think around slide 1 or 2, we talked about how surgical asepsis meant making items sterile, and this is really done through a 3-step process. The 3-step process is sanitization, disinfection, and sterilization. Sanitization is the cleaning process that inhibits microorganisms or pathogens through careful cleaning of the equipment and instruments to remove debris. This happens through rinsing and scrubbing of an instrument with a brush and a detergent with a neutral pH. So really what that is essentially kind of pre-washing or pre-soaking items prior to them being sterilized. You want to remove all the debris off of the instruments and rinse them in hot water and let them air dry. You do not want to scrub them dry or rub them dry, as it could tarnish the instrument itself. Even though the instrument looks physically clean after you sanitize it, it does not destroy the bacteria and the microorganisms, so it still has to continue through the process, even though it visibly looks clean. Step 2 is your disinfection, and this step you destroy all the activity of microorganisms. And we can use 3 different types of agents in this step to destroy those microorganisms. We can use chemical germicides or disinfectants. The most common one is a 1 to 10 bleach solution. That's 1 part bleach to 10 parts water. This is only going to be good for about 24 hours, and then you'll have to remake the solution. The other types that you can use are a flowing steam, like we used to do with baby bottles and the nipples of baby bottles many years ago, and boiling water. And the final step, sterilization, is a process that kills all endospores and microorganisms. This process is achieved through using an autoclave. And what an autoclave is it's a box that we have that sterilizes instruments using very hot steam at very high temperatures. Now, I want all of you to read up on the autoclave, how it works, and how to wrap instruments for autoclaving, as that will be something we will be focusing on this week. So, as you're preparing to prep for class on day 1, I do want you to read a few more procedures and review them. I already told you to check 32 34.2 and 34.3, but I also want you to look at 34.5, 34.6, and 34.7. So please make sure that you're looking at those, reviewing those, and reading up on them prior to class. They can all be found in your electronic ebook, but I also want to make sure that you guys are reading prior to coming to class, because that will help you be the most prepared for what is about to happen for this week. Again, if you have any questions, please bring them to class on day 1, and we will discuss them at that time. Otherwise, I look forward to seeing everyone on day 1 of week 2. Bye, guys.